Okay, I'm gonna get going in a second. And looking forward to sharing the next 20, 25 minutes with you guys, talk about mental health broadly in the context of IBD. And I think there might be two more people getting some food or a drink, so I'll kind of talk slowly from my introduction of myself. Background on me, I'm a clinical health psychologist. I work here in the Twin Cities with the University of Minnesota. I practice both outpatient, I do individual psychotherapy, as well as inpatient in the medical hospitals. I do consults with people who are admitted, coping with adjustment to illness, injury, surgery. So I see a lot of GI patients in the outpatient setting and in the hospital as well, doing individual therapy, supportive therapy, etc. No disclosures to tell you guys. I'm just regular old psychologist. So what I'm hoping to accomplish today and share, get the point across about, just taking a different approach in discussing mental health in general, and moving away from more of a deficit focus, meaning what's not going well, to a strengths-based approach, and figuring out what strengths do people have naturally, how can we amplify them, or how can we bolster them up to protect them in a certain way, to guard against poor mental health and negative impact. So I'm going to talk about what we call positive psychology. We're going to talk about ways to promote the different domains of positive psychology, well-being, and then even some specific things, some prescriptions per se, that you guys can be doing to work on these domains yourself. The idea behind my presentation is kind of based on this article from GI psychologists that they're trying to help GI providers use some of these positive psychology aspects in their practice, so they can be talking with patients right away when they get a diagnosis. Here's what we know helps people be resilient with IBD. Here's what we know contributes to better outcomes, these different domains, which I'll share with you. So that's why I wanted to share it with you guys today. And whether or not your providers are focusing on these topics, that's fine. You can share it with them or even kind of share it amongst your support groups and whatnot. So broadly, I have two slides just focusing on mental health burden in the context of inflammatory bowel disease. There's a lot of factors that contribute to distress, stress, etc. We know that the physical symptoms, of course, themselves, fatigue, pain, etc., leads to emotional distress, hopelessness, or it can at least, right, with certain patients. There's also a lot of social factors that can contribute to stress, sadness, like the burden of it, the stigma about a lot of managing the symptoms, what it means, shame, etc. And then regarding diagnoses made by professional mental health providers, we know that rates of anxiety disorders and depressive disorders are also fairly high, so around 20 to 30% for depression, up to 40% for anxiety. And this can be either like very specifically targeted depression because of the symptoms, or it can just be major depressive disorder where there might be a history of depression that gets activated even more so with disease, with IBD. We also know that can change based on whether the symptoms are in remission or active. Mental health symptoms usually increase when IBD is active, as we would guess. And when we compare anxiety and depression between IBD patients and other chronic health conditions, patients with other chronic health conditions, we see higher rates of IBD. So there's a particular burden, mental health burden in managing IBD. So that's why, and I'm not saying this to be a downer and to be kind of pessimistic, but more highlighting the need that there is within the patient community to address mental health. And then this slide, I think, is a nice overview of what are some common areas of concern for patients managing symptoms. Right? It's not only the impact of the disease itself, complications of treatments, and further escalation of treatment itself, right? Surgery, fear of cancer, fear of side effects, etc. There's a lot of sexual intimacy and relationship impacts. And then body stigma is a common topic that we talk about quite a bit in therapy sessions. Body image, how to cope with that. I have this ostomy bag and how I just hate it. People might say that. We kind of work on focusing on integrating into your whole self. It's a part of yourself and you are still whole. What we see is that when patients have greater concerns in these areas, it also correlates with poorer sense of well-being and can actually be correlated with health outcomes. Sometimes we might see higher rates of admission in the hospital, slower healing, less time in remission, etc. So we really want to address any concerns that come up. These are just some examples of the domains, not an exhaustive list. Now, what we typically do in our mental health care system, and this is true in the GI clinic as well, when we have psychologists integrated there, is we really focus on the patients who have the highest depressive symptoms, anxiety symptoms. We get those to a psychologist. We do what we call CBT, cognitive behavioral therapy, or there's also gut-directed hypnotherapy. Both of those interventions are really helpful to manage symptoms in GI patients. However, at that point, people are already really stressed. They're already having a lot of impact on their functioning because of their mental health symptoms. So what if we shift away, like I was saying, from kind of identifying people, not when it's too late, because those symptoms can be improved, but what if we get out in front of them and we try to put some protective aspects in place so people might not get, if there is depressive symptoms, there are depressive symptoms, maybe they won't get as severe because we can help people connect with their natural strengths and support systems earlier in the process. So that's where positive psychology comes in. This is a field of study that kind of was rebelling a little bit against this deficit approach. Why are we focusing on all the negatives when there's so much we can do to help people, empower them and help them feel better and build upon happiness, quality of life, etc. So it really focuses on strengths that enable individuals and communities to thrive. We want people to flourish. There's a lot of research in how focusing on positive psychology has health benefits in general. And there's particular application to the IBD community. And that's kind of what's getting underway research-wise. So it's exciting to share with you guys today. It's positive psychology as a field founded on the belief that people want to lead meaningful and fulfilling lives, to cultivate what's best within themselves and to enhance their experiences of love, work, and play. Growth-oriented, we want people to improve. If there's a deficit, we want to grow in that area. It's not just eliminating the bad. We're trying to enhance the good, essentially. It also really integrates themes of resilience, so the ability to bounce back from adversity, grit, the perseverance in the face of adversity, and long-term goals, and optimism. And also, I welcome questions. If someone has like a burning question about a clarification of a term or a thought, totally fine. Just let me know. So how this positive psychology approach compares to traditional therapy, I have this schema. So on the left side, you guys can see my pointer. This is how we would focus on helping patients who have GI or chronic digestive disorders. So we really look at identifying patients who might have risk factors for mental health conditions, like history of traumatic experiences, early life adversity, poor social support, or other psychiatric comorbidities. Maybe they already have a diagnosis of PTSD or depression that they've been managing before. So we would try to focus on these higher risk patients and then try to get them connected to resources once they start showing signs that they need it. So if they're not adapting well after we find out that they're having distress, then we refer them to a psychologist. That's kind of the pathway we have right now. So the complementary approach, if we look at more of a positive psychology approach, is that right from the get-go, we have questionnaires, we have things that we can be asking patients for them to identify what their strengths are in certain areas. If they feel that they're resilient, who is in their social support network? How do you get through, and how have you gotten through adversities in the past, and how can that be used now? So we're really kind of focusing on what are your strengths, right? This is hard right now. You can't just do this alone. You need the support, you need your own strengths, etc. So it's kind of, I guess, getting at a little baseline of resiliency and adaptiveness and building on what's there or shoring up what's not there. Patients can kind of, if they have a lot of strengths, it doesn't mean that they're not going to have depression. But at least we can try to prevent it. And then if depression comes up, for example, we can refer to a psychologist at that point. And the goal isn't to be meeting with someone forever or to be taking antidepressants forever, but maybe for this time to get through a really rough patch. And then when we can get things stabilized, whether that's a flare or, a social stressor, then maybe you can be leaning on your own individual strengths again. So one way that we think about what are the actual domains of resiliency and what are the domains I'm talking about with positive psychology, I'm going to use the acronym Revamp. So this is this model that was created by GI psychologists in a paper they published in 2019. If you guys like reading research papers, they're not pleasant, but this one's interesting because it gives you things that you can be doing. So here are the areas that we have seen correlate with positive outcomes. These are what we consider protective factors in patients with IBD. And you can see, relationships, and we'll focus on that, engagement, and we'll go through different ways of kind of identifying what that means and how you can strengthen that area yourself. Focusing on vitality, accomplishment, meaning, and positive emotions. All of these areas, if we can try to kind of have as many positive interventions, or like, maybe I can think about it as like points or tallies. You can get a point in each of these domains. That really helps inoculate you against further stressors, against transitions in care. If there's a flare, you have to go to the hospital. Kind of knowing what's available to you in these domains in advance helps you connect with them sooner and to cope better. Not an exhaustive list as well. I'm sure you each might have some individual resources and strengths that you've had to lean on as well that might not fit in these categories, but it gives you a good overview. And again, some people came in later. This is kind of built on an idea that GI providers could be integrating this in their work, not even by a psychologist, or maybe a social worker might do this if they have like intakes in the GI clinic. But it's meant to be built into the care. So for relationships, what we mean here is relationships in a patient's inner circle, like in their home, their friends, but also we want positive relationships with providers, of course. And based on research, what we see for GI symptoms in IBD patients, that when patients have poorer perceived social support, this is just based on their perception, not like number of contacts or actual people in their life. If they don't feel that their social support is adequate, we see more severe GI symptoms, more flares, the symptom burden is higher. So we see a correlation between social support and what's going on in the body. And that is an interesting connection if you think about it. It does not mean it's causing it, but that is a factor. Usually if people don't feel supported, they don't feel that they can cope as well with the stress of the symptoms. That's kind of the connection. So positive social relationships is really important as a predictor of life satisfaction and emotional well-being. Makes a little bit more sense. And we also see the opposite. Research about socially isolated people gives us a lot of indications about the importance of social support as well. So people who report fewer contacts, don't go out very much, they have heightened stress response, so they're more quick to react. They also have poorer health outcomes, so social support is very important. Here are some prescriptions that we would recommend to patients and that providers we would hope they could also recommend to foster improved relationships. These are 3 different areas. The first one being practicing some gratitude. Maybe you've heard this become more of a buzzword lately, having a gratitude practice. Literally just listing, what am I grateful for? Even if it's just in a day. Like today I was grateful I found a parking spot pretty close. I am grateful for having colleagues that gave me positive feedback about, whatever it is. Grateful for my partner for letting the dog out this morning and I didn't have to get up as early. So just doing that, the act of expressing gratitude internally, or even in writing a gratitude letter to someone from years ago, there's a lot of positive emotional benefit you get from that. And we actually see physiological changes when you're doing a gratitude practice. There's lower stress response in your body, less stress chemicals and hormones, and you would measure it in the blood or the serum. It's really beneficial. This second thing, active constructive responding, is a way of interacting with people that benefits both people involved. And the idea is just to it's about, I have this little graph here. The idea is that when someone is sharing positive news with you or news, you are responding to them in an active way, meaning you're engaged, you're expressing things, you're asking questions, and you're also constructive and helpful, authentic. When you respond to people this way, it's kind of like this spiraling up process. They feel good because you're engaged, you feel good because they're kind of vibing with you, and it's a good way to just accumulate positive experiences and contribute to positive emotional well-being. What we see kind of in the most negative quadrant here is that when people are more passive and when they're more, this says destructive, meaning they're critical of positive news that someone shares, they're not really engaging. That just leads to emotional hurt on the other hand, and I'm sure we've all kind of experienced people that might be more passive and destructive. And then it just creates this negative cycle where you didn't respond well to me, so I withdraw, and that just teaches the other person that you're upset, and it leads to just poor outcomes. So trying to be more active and constructive helps not only patients, their partners, and vice versa. It creates a more positive environment. And I wish that we could have, maybe I'll have to share this with my physician colleagues too, but wouldn't that be great if our physicians were also kind of using this active and constructive communication as well? Right? That would feel really good. The final aspect for prescriptions fostering good relationships is kind of fostering a positive relationship with oneself, and it's trying to implement a little bit more self-compassion. And as humans, we are very good at being compassionate towards others. We're kind of taught that to survive. We see a wounded animal, wounded person, we want to help them. It's less easy for us to be compassionate towards ourselves. It doesn't come as naturally. This might be just recognizing what I'm going through is really hard. Not many people understand what this is. Being able to admit that to yourself is really important. It validates yourself and it contributes to positive mental health. So the next letter in the Revamp, engagement, and this just means the more we see people being deeply immersed and engaged in their daily life, the better positive outcome, the more positive outcomes we see emotionally, the more protective it is. When people are disengaged, when they're passive, when they're isolative, that's associated with negative outcomes, mentally and physically. We want to foster engagement. We know that with IBD symptoms, that's a big barrier to being able to be engaged, maybe in the way you want to be, or in the things you were able to do before symptoms were at a certain level. So we recognize it can be harder to find ways to engage at times with anyone with chronic illness, right? Pain, fatigue, big limiting factors. So some ways to increase engagement, some basic practices, these are the prescriptions for that, would be trying to be more mindful, whether that's like having a mindfulness practice, you're trying to do some meditations where you're focusing in the present, or just saying, I'm going to be more mindful today and try to be aware of my surroundings. It doesn't have to be like a Buddhist meditation, but ways to be more mindful and remind yourself that you are here in the present. You are not worrying about what's happening with the infusion and the insurance outcome next week. We're not worrying about what happened last week this year. Another way to be engaged is to really kind of lean on your character strengths. You find more natural engagement and interest in the things we're good at, right? Things that come naturally. So if you have a good grasp of what are my strengths, you can choose to spend your time in activities that align with those strengths. So at the end of my talk, I have some resources. There's a good online tool to identify character strengths, the VIA strength study, some questionnaires that just help give you some good terms and some good analysis. What are your strengths? Sometimes it's hard to kind of say positive things about ourselves and allow ourselves to identify our strengths. So having a tool can be useful. And then vitality, what does that mean? When we say we want people to be high on the level of vitality, it really just means like we want you to feel awake, alive, feel like you have the capacity to face challenges. Your body's ready to jump to if you need it. And that can be hard to do when you're feeling ill. So this is what you're going to get in your doctor's office, meeting with a dietitian. You want people to have good sleep. You want people to be getting adequate nutrition so their energy is at a good level to face the day. You want them to get physical activity in a way that feels good to them. I'm not going to talk too much about this. You don't need to do too much health behavior counseling, but that's kind of what this area entails. We can't just look at our mental health without focusing on our body's health and wellness and, having our body be able to be as fit as it can or as vital as it can. Accomplishment. This is a really important aspect of positive psychology because a lot of times we might think that we're doing everything we need to do, but if we're not seeing kind of positive but like progress towards something, you can tend to feel a little bit stuck, you can feel a little bit hopeless, like we're just a little bit floating out there in outer space. So setting goals that are realistic for yourself, whether it's health related, whether it's personal, whether it's professional, is a really good way to boost your mental health, to provide some protective factors for your mental health. So what I have here is a really common goal setting schema called SMART goals, SMART being the acronym. I'm sure, someone raise their hand, like this is very common in management, like business now. We want to set goals that are specific to ourselves and like delineated. For example, I want to run 5 miles or I want to be ready for this 5K by October 30th. The goals need to be measurable, meaning you can track your progress. It can't just say, I want to feel better someday. How am I going to know, am I better? Because today I might be better, tomorrow I might be worse, but you need some objective measurements. Goals should be attainable, they should be relevant to you and not other people, they need to be meaningful, and time-based. Set a deadline for yourself. That's really key. All of this, easier said than done, right? But this gives you a place to start. So if you've been feeling a little listless, you've been feeling like you want to take on a new project, find something, this could be a good place to start. Set a goal for yourself and work towards it. And then just 2 more letters. So the M in my Revamp model means meaning. We want people to be able to find meaning in their life. I have a lot of patients that just feel, they say, I don't know, I just don't trust myself. I don't feel like I know who I am. I don't have anything that gives me meaning. People kind of feel lost. Our identity can shift a lot when we have a chronic illness too. Who am I? Sometimes people feel divided between before and after, and that can be really challenging. So when people find meaning, one way we help people find meaning is by asking them, well, what are your values? What do you value in life? And let that point you in the direction of meaning. So what a value is something that's so important to you. It's like your compass. I have a compass photo up here. It's not the same as a goal, like I'm going to set this goal and I'm going to reach it and then I'm done. You can never reach your value. It's more of a direction that you're walking. Okay? For some people, these are just like some examples of values. Some people, their family relationships are their utmost value. And a lot of decisions they make in their life need to align with the family and supporting them as well as themselves. So that might be a way they find meaning and make decisions. For other people, maybe it's their professional life is what they value the most and their identity there. So they make decisions based on that. Your values are unique to you. We might feel pressure to list certain values based on our society. And that's something that's really important to think about for yourself and be honest with yourself. Because you're not going to find meaning if you're trying to live someone else's values or what you think you should be doing. You're constantly empty, unfulfilled. So we have also a lot of tools to help people identify what their values are. Like lists 300 words long, and you start by just like, what seems like me? Do I like adventure? Do I like friendship? And then you whittle it down to kind of what are my core values? And that's a good way to use this. If you have some empty time or if you want to take on a new project, if my value is spirituality, well then maybe I'm going to volunteer with this church organization. And so that'll give you more meaning. And then the P in Revamp is for positive emotions. What we want to do, I have this like balancing act up here. The idea is that we know there's a lot of negativity in this world with our health. We do not want to deny that. Because we're not trying to erase reality and ignore the fact that people are struggling globally and individually. What we do want to do is try to balance the negative emotions and create more opportunities for positive emotions in our life. We want to have a balancing act. Our brains have developed a negativity bias, which means it can be easier to remember negative events that have happened to us. Because of that, we might need to double up on the positive. I use the word inoculate ourselves against negative earlier. Inoculate. If we can accumulate positive experiences, we can handle the negatives better. How we do that is very individualized. Right? List some examples of positive emotions here. Some interesting research about when people are higher in these areas of positive emotions, what we see. People who have positive emotions, even briefly, they report more creativity, they're more flexible, they're more efficient with information processing. They can take in more info and respond more readily. They also can help modulate the pain experience. It doesn't mean that it's going to improve maybe the site of the pain, but it helps people feel that they can cope with it better when we have more positive emotions. And they also counteract things like rumination, which is really associated with anxiety, thinking about things over and over. They combat helplessness, magnification, kind of making things bigger in our minds than they are, and pain catastrophizing, which is this idea that once pain starts, it's never going to stop. There's nothing I can do to control it. I'm completely helpless, etc. Again, the goal is not to eliminate negatives, but to find more balance. Here's 3 ways that we've found that can help facilitate positive emotions. You can probably already think of some for you. Watching your favorite funny movie, But the 3 blessings is similar to gratitude practice I described earlier. It's just reflecting on 3 things that went well. I suggest writing it down if you want. Also scheduling time for positive emotions. Like, I don't know about you guys, but if I don't schedule something into my day, it's not going to happen sometimes. So making sure something's on your calendar, maybe like once a month, something bigger, like going and getting a manicure, right? Once a year, even bigger, going on a trip to your favorite place locally you can drive to. Scheduling things is so important. You get to savor, like, the looking forward to it, and then the doing it, and then reflecting. And then also using the body to influence the mind. This one's really interesting because there's so much research now about the way in which we inhabit the world with our body and how that influences our emotions. So I don't know, have you guys heard of power posing or seen it? But power posing is like taking a powerful stance. And they do research studies where they have people doing this for a minute, and then they perform a complex task. Then they have people who don't, and they perform the same complex task. The people who do the power pose, they actually perform better. And that is so interesting. With the smiling studies, this was done, I can't remember, they did in Australia, and they had some patients hold a pencil in their mouth. So it's creating the same thing, creating the same muscle movements as smiling, but you're not feeling happy. So it's literally just like holding a pencil in your mouth. And then people who don't. And then they show them different pictures. Like maybe they're happy pictures, maybe they're sad. They're a range of emotions. The people who had the pencil in their mouth and who were smiling, they rated the pictures more favorably. They rated them as more positive. So that's why we can see that even just using your muscles to smile, or even if you're not happy, it can have a positive influence on how you're looking at the world and interpreting it. The little ways that you guys can do this, like even if before I go to work, sometimes I'm like in my car and I know it's going to be a long day. So I'm like, make myself smile for a second just so I can like get a little boost before I go into my day. Things like that are small things you can do to increase positive emotions. And last but not least, these are just some tools and online resources that relate to the different areas we talked about today. Some are guided recordings for compassion, like self-compassion practice, mindfulness. Others are different phone apps you may have heard of before that also have some guided tools. And there's some values identification information, the strength assessment. I feel like you guys will have access to these maybe after, but I'll leave this up. I don't have any more slides if you want to take a picture or write it down. So that's my presentation. I'm happy to answer any questions that you guys have. Yeah. So could everyone hear? So peds for kids. Yeah. And I feel like a lot of these things, they all would apply to peds, but the examples would be very different, right? Do you mean like resources and ways to do it? Or? Mm-hmm. Yeah. Got it. And you're trying to figure out ways to kind of protect her mental health and like foster strengths. Yeah. That is not something I'm as familiar with. I don't work with kids, and I would love to ask someone and get back to you if we could exchange information. Yeah. Anyone else have ideas that have been a pediatric patient and have kids that like protective factors they found that align with this? Happy to source from the crowd. There's someone over here. That's good. Spending time with family, giving positive compliments. Is what you said? Thank you. Good insight. Cool. Okay, we'll wrap up. I got the sign. Happy to continue talking now. Thank you guys for your attention.